My name is John Lynn. I'm the founder, chief editor at Healthcare IT Today, a health IT publication with 16,000 articles, 200,000 followers. So we have 3 podcasts now too. So check that out at healthcareittoday.com. Appreciate you coming to do this. I'll be moderating this panel where we're diving into multi-cloud. And it's funny, about 5-7 years ago, I was at a CIO event and they said, well, they asked the question, are you using cloud? And this was only 5 to 7 years ago. And this older CIO lady, she was there. She's like, well, yeah, but we don't want to. And it's amazing to think about 7 years later, like whether you want to or not, you are using it in a massive way. So we've seen quite the evolution. And now we have to understand, how do we manage it? How do we manage the costs? How do we address it properly? So I think our panel today is going to give some great insights and perspectives on that. If you're live tweeting, I see everyone on the phone. I'll probably on social media checking out. Be sure to use the hashtag #TransformHIT. So if you use that hashtag, Dell uses that to share a lot of great content. So be sure to check that out and use that hashtag. Follow along with others in the audience. So let's go ahead and go down the line and do intros. George, do you want to start us off?
Good morning, everybody. I'm George Morris. I'm the Global Healthcare CIO for Dell Technologies. I do solutions and strategy for some of our largest customers globally. I've got 30 years in healthcare, been a CIO for over 25 of that. And for Dell, I do transformational and multi-cloud strategy. So looking forward to the conversation today.
Excellent. Good to have you here, George. Sunny?
Hi, everybody. My name is Sunny Southern, and I'm responsible for the go-to-market strategy for our cloud AI and industry solutions at Google Cloud.
Awesome. Welcome, Sunny.
Hi, thank you for the invitation. I'm Juan Luis Cruz. I'm the CIO of a big public hospital in Madrid, in Spain. When John asked me to participate, I said, hey, I don't know almost anything about multi-cloud, what I'm going to say here. So I think I have more questions than answers. So I'm here to learn.
Well, and that's where we thought it was interesting. It's like, well, someone that's beginning this journey, because in Europe they weren't allowed to do it for a lot of things. That'll be interesting to see. How are you thinking about it? And also, I think he's conscious of his amazing accent, but to me, it's just beautiful. So I think we can all agree that his accent, we're all just jealous of. It's not a problem. So welcome, Juan Luis, who traveled the furthest, I think, from Madrid. Jim?
Hey, thank you for having me. Jim Bilski, Vice President, Enterprise IT Operations.
Probably need to go a little closer.
With Baptist Health in Jacksonville, Florida. We cover about a third of healthcare in the region, and certainly glad to be here. And we've started our journey, so certainly interested in sharing thoughts and learning from the panel as well.
Well, Jim, how about you start us off, right? What are some of the most important considerations when selecting and implementing your cloud infrastructure? I'd love to hear how you're approaching cloud at Baptist.
Yeah, so we recently started our journey, and it's about partnership first, leveraging the partners that we have in place, and then getting organizational buy-in and commitment so that we have leadership support from the top down, and then that helps us with the transformation from the bottom up.
Yeah, any idea how much is in the cloud, how much is on premise, and any feel for how many applications are moving that way, and what's driving that? Is it most of the applications are only in the cloud, and so that's doing it, or what do you think about that strategy wise?
Yeah, great question. So we're probably 10% in the cloud, 90% on-prem still. We're aggressively moving. We've got some proof of concept that are in the works immediately, and hopefully by the end of the year, we'll have that number flipped substantially. And it's all about agility, being able to respond quicker to the caregivers and being able to provide clinical solutions so that we're not in the way of what needs to be done. Because if it's a technology discussion, it's already too late to impact change.
Interesting. So sorry to, hammer on you. This is so fascinating. But, what is those considerations? Is it cost? Is it what's going to drive the best use case for providers? What's driving that?
It's a combination. Skilling up folks, obviously, is a big aspect.
Yeah, that's interesting.
How do we get the right skills? How do we transform our team members? Being able to respond faster, right? So with a traditional infrastructure commitment, the procure cycle, the supply chain challenge comes into play, and just responding to the clinical demands, which are more urgent than ever, it's just too slow. So our ability to be very agile and respond quicker is really the driving factor.
Wow. Well, and I want to get to the people part in a little bit, but Juan Luis or George, go ahead. Yeah, I'd love to hear your thoughts.
So I think that's the key piece, right? People part. So what I see organizations that I work with on the multi-cloud journey is the technology gets pretty obvious. The integration, the on-ramps, the off-ramps, looking at the economics, the value propositions. We can get into all that in the discussion. But what I like to advocate for is you got to look at the people process side. This is a retooling of IT as much as it is a journey from a technology perspective. So you have to start looking at operating model. You have to start looking at frameworks from a Google perspective like SRE, and bringing those new skill sets to be capable within your organization. You also have to start looking at things that are closer to a plan, build, run framework, because the idea of this is to get to that agility. You want to make sure all your intake now is totally tied in from a plan, build, run perspective. So operating model is key to make the successful journey, and that operating model actually has to be slightly in front of your technical cloud migration. So it sounds like you have more on that.
Yeah, Sunny.
Yeah, I really love that. And I love that plan, build, run. Yeah, we've also heard like walk or crawl, walk, run, but I really like that plan, build, run. And I think that planning piece is so critically important. And I think it's more important than ever that we're empathetic, so that we stretch ourselves and we have empathy. So you had said the technology side is easy because you're an incredibly experienced CIO, right? But for a line of business leader or an executive, the technology side's really hard. And so on that plan side, it would take a little bit longer to really understand the business needs and set those KPIs and try to translate between what the technical side expertise is and the line of business needs. Then we're going to have better outcomes in the long run. And I think that's going to be more and more important as we're able to automate more of the mundane tasks. So we free people up from doing mundane things to spend time on things that only people can do. And that collaboration and understanding each other's perspective and translating is going to be really, really, really important.
Sunny gets a prize for mentioning AI first. That's
So along that model, absolutely, and that's on the intake side. But there's just an interesting statistic that we've uncovered in the last couple of years. Traditional IT departments spend over 70% of their day-to-day activities keeping the lights on, those mundane tasks. So that planning piece, like you talked about, there's the bang for the buck. That's the value proposition. You want to free those folks up in an operating model, leveraging skill sets around something like cyber reliability engineering, SRE, to be able to spend greater than 50% of your time moving the bar, helping out with the intake, looking at those business leaders, developing capabilities in a service catalog that's going to bring that value versus doing the old admin stuff. So yeah, that's a really great point.
So we in the public sector, I think it's in Spain, but in general in Europe, we have been laggards adopting cloud technology, and mainly I think it's for data protection concerns. We are working with health data. We are a public institution. We have to protect it, and so maybe it's critical for us the trust in the provider. Trusting the provider, they are not going to use the data for any other purpose. It's one of the key components for us. Data protection certification is also critical. In Spain we have a very restrictive legislation, not only in Spain, but the GDPR is quite restrictive. And in Spain, we have moved the bar further. So we have what we call the National Security Scheme, and it's more restrictive than the GDPR. So now providers are certificating themselves in this kind of security standards. So it's much easier for the public administration to contract with them. And also it's helping a lot the location of the data centers in the European space. And in fact, we are seeing that many of the big players of the market are establishing themselves not only in Europe and not only in Spain, but in Madrid, just to make that better relationship. It's a cloud, but it's not that cloud concept of is data is anywhere you don't know. It's located near you. So it's a change. I think it's a change of paradigm, and it's probably something that is helping us to starting to adopt the cloud.
Well, let's talk about that one, because it's interesting that, and this has always been the case, security versus accessibility, like we want to have data everywhere that it needs to be, but how do we do it in a secure way, right? And you're dealing with that. Have you suffered from not being able to adopt the cloud because of that? Like, are there opportunities where you're trying to push them forward because you're like, hey, if we were in the cloud, we would be able to scale up when COVID happens and I need 10 extra desktops or whatever, right? Like, what are some of the challenges because you haven't been able to adopt cloud?
Well, we need both. We need accessibility and we need security. And when both concepts compete, security wins. Because it's in the law.
In Spain.
It's in the law. Here, there in Spain. So, for example, COVID taught us that, doctors need to continue their work at home because, we ran out of doctors in the hospital. Many were also with COVID, so they had to work remotely. So we lowered the security bar because we didn't have any other solution, VPNs, access to our local networks, but of course cloud could have helped us a lot in this thing. And I think now it's been seen in a different way from the public administrations,
So it's opened their eyes to that, this could be okay.
Open their minds, I think, a little bit.
Nice. Jim, go. Well, let's say, go ahead, George. Go for it.
The area that I think gets overlooked as it relates to where there are gaps or where you haven't been able to do things that you might be able to do is in an area, especially in the area of research.
Okay.
So because research, when in computational biology and in genomics, these are areas that really help healthcare organizations become leading organizations. And when there's a lack of computing power, then the researchers then have to schedule their jobs, and it takes much longer to be able to do their really critical research that helps these organizations stay ahead of the curve and create those life-changing discoveries. And so those are things that aren't necessarily obvious. People aren't out looking for them because you don't know what you don't know, but it's definitely an area that we've seen where the researchers suffer.
Definitely. If you don't implement cloud the right way and they're waiting days rather than hours, that's a huge
or
impact.
months, weeks or months at times.
Which is sad to say. The computing power is there, so that's a problem. Jim, I'd love to hear your thoughts on kind of this balance between, okay, well, we want it to be accessible. We want it to, be, quick and effective in the cloud and all that provides, but still maintaining the privacy and security. How are you thinking about that? And maybe even, expanding to kind of compatibility across different solutions, right? Because, we say multi-cloud for a reason. There's multiple ones that you're managing. How are you looking at that?
So the easy question, obviously.
Yeah.
The security aspect is always a challenge. I think with our engagement of our CISO being at the beginning of all our initiatives, right? So that process starts as we contemplate solutions, taking a multi-layered approach, and really taking it from the clinical provider in rather than the security side out. However, the security side, I don't want to say trumps anything. It's not no, but how can we? Right. So it's just a change in mindset and engagement and good governance across the board that vets it out and really works through whatever the request might be or the access needed across the board. So I think, those really enable us to be successful in that way, and really lends the commitment of us, which is not be the barrier, right? It be the enabler rather than the barrier.
And has security been part of the reason you've been a little reluctant? I mean, if you're at 10% to adoption, that's how I'd describe it. But
no, I think the hesitation's been a cost model,
okay,
more than a security model, right? So it's an operating cost versus a capital cost
Gotcha.
mindset, just a difference. and really being able to show, as we talked, right, the ROI, the value of being able to respond quicker, to retool back the operations team, which is taking a significant amount of resource time, and redeploy those to other more critical needs across the environment.
Yeah. Yeah, go ahead.
Another of our concerns is also vendor locking.
Say again.
Vendor locking.
Oh, okay.
So, we can start moving to the cloud, moving critical assets, moving huge amounts of data, and then what happens if the vendor changes its policies or stops giving service? And maybe multi-cloud could be a solution, but we have doubts about that. Is a solution, or you have multi-locks?
So that's the concern, is that now I'm locked into three vendors.
I'm moving, for example, 1 petabyte of data of digital pathology imaging to the cloud. And what's happened if I want to get the data back? I don't have the infrastructure now. I don't have the people trained to manage the storage servers. So
yeah,
some fear of being trapped in that model,
Yeah, that makes sense. Sunny and George, any thoughts on this or other considerations that we haven't talked about?
So I think it's a very legitimate concern, and I think it goes back to the plan, build, run, right? That first part of planning to make sure, because I think you're exactly right, is that once you start taking those steps and getting on that journey, it's very hard to go back. Because what happens is that, generally speaking, your lines of business users really appreciate the flexibility that they get. And once they start getting that flexibility, your researchers have better access to more computing power. It's very hard to then go backwards. So that planning part's really important.
Yeah, I think as we kind of transition, let's talk about around security, what some of these best practices are, right, and how folks are starting to solve it. Security is certainly important, but I think a lot of the multi-cloud hyperscalers like Google and others, they're coming around and being able to do things and be able to solve that and help you and have some assurances, and in North America at least sign BAAs, sign limits of liability, all that good stuff that lets the lawyers feel and the security folks feel a little more comfortable, providing demonstrable evidence with HIPAA. So we are seeing that change. It is a little lagging in Europe because of some of the data sovereignty issues, but it's coming along. And I would say even in the last 12 to 18 months, it's much more mature in what I'm seeing globally than it's ever been, because of folks like Google really addressing those issues and making it a little bit of an easier button for health systems to come aboard. So if you're going to look at this, there's kind of 4 things you have to look at. We've talked about security. That's certainly important. Value prop, understanding what the cloud is going to bring to you, how that's going to bring benefit to your clinicians and business, and then how, again, on the operating model, I'm going to harp on this, how are you going to integrate in a framework to make sure you're hitting those KPIs and exploiting capabilities as you're moving folks into new roles. So certainly security, value proposition. The third one is, along with the data, I'm an apps guy. You got to start with the applications. So certainly in research, data is important, but the applications control those sources. Multi-cloud doesn't work without doing an app assessment, understanding your dependencies, and again, then applying the value proposition and the security to looking at your products in your portfolio and trying to understand where does it make sense to do things. Let's face it, healthcare, our application architectures are aged. They're not modern, they're not container-based. So in the essence, on the tech side, it's lift and shift IaaS. The applications are very dependent on underlying infrastructure for their SLAs, for their security. You got to understand all that. How is that going to change and where that value proposition is? So we've talked about security, we talked about your value proposition, we've talked about your applications, and then finally, I'll keep saying it, operating model. Those are the 4 key pieces, and having a plan around all that to make sure you have a successful migration strategy.
It's not just set it and forget it, huh? This takes work.
Yeah, and it is a journey, multi-year. So you've got to also look at in your plan, what does that timeline look like? What's going to change in that timeline? what is your business as usual? What are your architectures that are going to age out while you're doing that BAU? And maybe you are going to keep things in and make different kinds of decisions based on some of your opportunistic spend and some of that value proposition. So it gets interesting.
Yep, absolutely. Yeah, and I'd love to, if anyone has any questions, we love to take any questions from the audience as well. Happy to get your questions answered. We love when people have questions, we'd rather have them answer what they're looking for. If you have challenges or things you're working on, we'd love to have those. So just give me the universal, hand wave, and we're happy to involve you. But let's dive into the cost question. He raised the cost question, right? That is a challenge. How are you thinking about it, Juan Luis? And then maybe Sunny, you could answer after. How do we talk about costs? How do we justify the ROI of this? And how are you looking at approaching it, especially as you think about a transition?
Also, one of the challenges that we have been facing is just comparing offer. It's not so easy to compare different offerings from different providers.
Right.
Of course, you can compare CPU, storage, but it's not. It's much more difficult to evaluate resiliency, for example. So comparing offers is difficult. The procurement process is something specific of the public sector, but is the contrary of agility. So the application is to scale fast according to the necessities, and the procurement process is exactly the contrary. Months of elaborating all the administrative process, and also in a multi-year strategy is difficult to engage because the public sector has to open the tenders to every available provider. So if we had a partnership with a big player, and after that, while we are moving to that cloud, 3 years later, the provider changes, what happens? So the procurement process is something that goes against the public sector adopting the
Interesting.
cloud.
So the procurement's a challenge. That's interesting. We'll get your question in a sec. The procurement's a challenge, but then also I think you highlighted something interesting, which is we're not just buying cloud, right? Like there's not like one cloud product. When you go to any cloud vendor, there's this whole suite of products that you buy within the cloud, including backup and resiliency and disaster recovery and along with CPU and all these things. So, wow.
So feeding off of Juan's question, in terms of, and this is a question for Sunny and George, really, have you as a provider of a multi-cloud strategy ever received an RFP to do something as such from a health system, or is it really an assessment approach and each one is very much an individual thing? So, what really is an approach that, these guys would want to hear about? You first.
So your question about have we ever received an RFP to really do a complete transformation of an entire health system at a country level? Yes, of course, because that's a lot of the ways that they operate. And so I think, John, you started to hit on it, and that it's not just about multiple products, but it's also about a relationship, right? And so at the end of the day, there's still a relationship with people that needs to be met. And for all of the hyperscalers, there's the relationship with the hyperscaler, but there's also the relationship with our partners. And so at Google Cloud, our partners are critically important to us, both the systems integration partners as well as our independent software vendors. And so we come to our customers with this suite, if you will, of partners to help so that we make sure that we have the specialized expertise that our customers are going to need, whether it's a point in time type of project or it's a multi-year RFI.
We've responded to many RFPs of many different scopes and sizes. Everything from full-blown kind of moving all the way to, we're going to do this in a step fashion and kind of a now, near, far. So I think organizations, as they're putting their plans together, again, that value proposition and what they're trying to look at getting out of a multi-cloud strategy really relates to what an RFP will look like, or again, what presentations and capabilities we're going to bring to the table. The most successful folks that I've seen out there have done this in an incremental fashion and done it bit by bit and revved up and added velocity and scale. So they're going to start smaller where their low-lying fruit is, and in trying to understand what that value prop is. An academic institution, and working with Google, we do a lot of work with Google. Their analytics tools are awesome, and academics want to be able to reach out to that. They want to be able to get the data across to it. So that's typically for an academic and research where we see that first bridge happening on how can we expose those tool sets out to our data science folks, to our researchers, so that they can have an easy button to be able to hit and say, I want to take advantage of that. That's just one area. I've seen other organizations, they've got a data center that's aging out and they want to start moving workloads. They want to be in the data center business anymore. So they're trying to figure out, how do I drain that data center out? What needs to be maybe in a multi-cloud on-prem solution? What can we outsource? Can we do a DR as a service strategy in a multi-cloud perspective? So find out where that value prop is, and then if you need RFP, that's where you go around doing it. And Baptist is on that journey. That's what Jim will tell you about. So maybe Jim, you can talk a little bit about what we talked about in your briefing and where you guys are.
Yeah, that'd be great.
Yeah, absolutely. Also, back to the cost question. As you have an aging data center and infrastructure, there's life cycle costs associated with that.
We forget the cost of the legacy.
It's not the initial purchase, it's the purchase thereafter every year to maintain it, keep it fresh, keep it current, and returning that capital back to the organization. For us, we're still growing. We're in Florida, so we follow the rooftops, lots of new rooftops being built. So we're still expanding brick and mortar. So being able to give that tech capital back to the business to use that for growth to take care of the patient is also a cost justification of the flexibility and dynamics. Also, being in hurricanes, we do have to prepare, and that is also a level of cost that the cloud helps with greatly, right? Disaster recovery as a service. I don't pay for it year long. I don't have to do that investment. I can spin it up as needed, because our events are usually maybe 3 to 4 days in length. But if I have infrastructure sitting there, it's 360 other days it's just sitting idle, not used, plus the operational time to maintain that system, to validate it, keep it current, because when they need it, there is no time to check it out after that.
That's a great example. I mean, the hurricane's coming, and luckily we have great systems now to know that it's coming. Great example.
Jim, you made me think about something. One other key piece back to the RFP question is the understanding the economic values of the cloud is all about utilization. And again, application architecture is really dependent on that. So as you're looking at all this, and we've been helping Baptist look at the cost models, I've got a couple large organizations doing that today. Some of that will be published, so we'll be able to have that information available to you. But by application, you're going to have a utilization model. These are older applications. Some of them move well, and you can do exactly what you said. You're not using the infrastructure, and it's a great way to do it. You got a pilot light, you're paying for scale, rapid scale capabilities, great economic value. But some other of our applications, like some of our EMRs, don't necessarily, they're more persistent and utilization goes up. So you've really got to understand all that as you determine your multi-cloud strategy. Again, picking out where exactly your first low-lying fruit makes sense, doing that operations analysis, and making sure your total cost of ownership over the life of the solution makes sense for you, and then you place workloads where it makes sense. Some apps move really easily and it makes all kinds of sense. Some don't. Some are more persistent.
Just a really quick comment, and I'd frankly love to hear from you all too, is that what we've found is that for some organizations that have been a little slower to adopt the cloud, a really good place to start is DR and backup, especially in places where you have risks of your colo being not available due to a hurricane or other natural disaster. It's also really important for our underserved communities and places in rural America. that it's harder for them to necessarily get to the cloud, but they recognize how important it is because they don't have as much access. Did you want to say something?
No.
Okay. Would you want to talk about that?
Yeah, absolutely. So, there's a lot of dynamics. So Northeast Florida is very large space, lots of land to cover. Our patient population is spread across 5 counties in the Northeast Florida area. And making sure that a hospital that, we have 2 hospital locations literally a mile or so from the ocean. They evacuate, but we still have to take care of that community. We have other hospitals further inland, and having a resiliency plan to support the community and transport and make sure services are available wherever they're needed is critical. Also for our cancer center, so we have a large cancer center. Those patients are more at risk for mistreatments protocols, where you're not just missing a family practice or a wellness checkup, you're missing chemotherapy treatments or infusions. And that, beyond the medical side, the emotional side on the patient and the family is great. So having a plan around that as well in the cloud, certainly helps us do that effectively and cost effectively as well.
Not to mention the revenue side. Those are expensive treatments that if they get delayed is a big problem. It's interesting. There's a lot of things that happen in IT. It feels like Groundhog Day. And I wonder with cloud, are we heading down the same pathway we did with, I could list a bunch, but like communication systems, where we now have 15 communication systems in a hospital, right? And we're like, why do we have 15? Are we headed down that same path with cloud where we're going to have 15 cloud providers? Or how do we keep this, simple so it's easier to manage and more secure, et cetera? Any thoughts on that? And are we headed this direction?
That's an awesome question. So you end up multi-cloud whether you know it or not. Whether it's one of the large providers, or it's your EMR provider, or one of the systems that you need that connects to your EMR and you're hosting with them, quote unquote, right? So you're there one way or the other. I think it's back to the conversation earlier. It's finding the partnership and engaging at a different level. It's not just a transaction. When it becomes a transaction, that becomes more problematic. You need good partners for the data side to know that you're going to be, well taken care of in the event of something does go wrong. It's not, that it's not going to go wrong. It's just, when does it go wrong? And how do we properly respond quickly to that scenario? George?
Yep.
At least in North America, I can say, from an applications perspective, if you have a SaaS system somewhere, you're multi-cloud, because chances are that SaaS is being hosted by someone else, either with Google or AWS or one of the other hyperscalers. So you're probably already in a multi-cloud strategy. Hopefully, from a HIPAA and contractual perspective, you're ferreting that out. But I know many of the PACS vendors, if you're looking at PACS as a service, they're only doing the managed services side. They're hosting the applications and the data with one of the hyperscalers typically. So you're doing multi-cloud whether you know it or not.
Is that a problem to keep, to have all these, One of the ways that we deal with a multi-cloud, in like a multi-cloud world, which we're in it, whether we know it or not, is by embracing the data standards. And so I think we've been a little slower than I think what most of us would like with the adoption of FHIR, Fast Health Interoperability Resources, which is a new HL7 standard for data interoperability. But the more that we can make our data interoperable, the more that it can actually avoid things, even like vendor lock-in. So of course you need to design your systems so that they are container-based and things like that. But you can also make the data flow between these applications if you're using the standards.
Interesting. Juan Luis, how about you? As you kind of approach this, how are you trying to ensure that it's simple and manageable going forward?
I agree with your vision that we all are multi-cloud. We are. Probably the key point is to have. It's not the same to be multi-cloud than to have a multi-cloud strategy, and I think is the key point, and is the tough one. It's not about buying cloud services. It's about having a well-defined multi-cloud strategy and trying to harmonize all these mess of applications, different providers. I think is the key point. Is the top one.
Yeah. How about the people? I mean, you started that conversation as well. How do you go about, in Spain, it's probably extra challenging since you haven't had as much cloud infrastructure. How are you looking at people? And, I don't know if everyone noted, I noted Jim's first comment was, we need good partners, which sounds like a people comment as well, but.
You have to think on our environment of people that is usually working in the same hospital for many, many years, that are used to work in a certain way. And you are asking them to change 20 or more years of work quite fast. So,
and there's not policies to say "see you later," right? In Spain, you can't really
if you are
do
a public health worker, you have your position there.
Yeah.
So it's not so easy to move people forward, and it's one of the biggest challenges in our side.
George?
So we've got some organizations that have shown us some best practices that are migrating people. The biggest challenge for, I think, healthcare IT is finding and retaining good folks that have cloud capabilities. I have cloud architects, that kind of skill set. What I hear from my CIOs and my cloud directors that I deal with is these folks are in such hard demand that it's very, very difficult to do it. So the best practice methodology we've seen is how to grow them. And we've got partners we work with that help migrate that operating model and start helping folks do that transition. And some of the most successful organizations with this plan that I work with have done that exactly. Now, some of the folks have worked there a long time. Some of them are having a little harder time coming along. There will be some folks I think you'll end up dropping or replacing over time. But the vast majority of resources, again, if you get it planned right, you get the change management right, they will start to migrate and come around, and you very quickly get a good educational plan in place that starts changing, as an easy example, an admin into a site reliability engineer. It's not that big of a jump. The skill sets are similar. You just got to add on top of what they already know, and it's a pretty successful strategy. So you're going to have to probably partner. You're going to have to probably have some augmented resource capability for a while, some side-by-side training, but it is possible to grow these folks internally.
Yeah. Sunny, any thoughts on this? I mean, everyone wants to work at Google, right? Is that? But even then, you want to work with good partners that have expertise too. So your customers are a challenge as well.
Yeah. I think that it's a challenge. And yes, everybody does want to work at Google, and we hire a lot of people, and we know that it also creates some challenges. And so we intentionally have a lot of education and training that's out there that we offer. And at the end of the day, though, it's important that we work together with our customers to figure out what your needs are and design those training plans that are really tailored to what your needs are. We haven't really talked about generative AI and LLMs and more around the automation side. And I think it's our responsibility as hyperscalers and vendors that we create products that are actually really easy for people to do things like transition from an admin to, a cybersecurity admin or to other types of roles. And so our commitment is really around how do we make our tools easier and easier to use so that it's not such a hard leap from one discipline to the next, or from an old way of doing things to the new things. I mean, there still has to be commitment to some change, but hopefully we're building technologies that are easy enough to use so that it's not so hard for the transition.
Yep, definitely. George?
Google has some great framework on and educational materials and lots of online resources that kind of talk about what this transition can look like from a more traditional model into a multi-cloud or cloud engineering model. It's really good stuff. So a lot of the partners, we have a lot of that as well. There's lots of capabilities now that talk about how to grow these folks, and then you find the right partner to engage with, and they'll help you do it. Google helps you do it too. So.
Yeah, George, you hit on a great spot, right? Growing them. So, from a healthcare perspective, trying to get a cloud architect in Jacksonville, Florida, we're competing against everyone. Working from home has added additional complications. So for us, we need good partners. We need one or two experts, and then we need staff that are energetic and have the right attitude. We can teach them the skill, but you can't teach them the behavior side or the attitude side. So hire the attitude, hire the energy, hire the passion around whatever, and then direct that towards the multi-cloud, turning them into an SRE engineer, turning them into something that they envision themselves, and then grow that internally rather than trying to recruit it externally, because we can't compete financially for those resources anyway.
Wow, interesting. Well, let's go down the line and just get some final thoughts on what you're thinking and what you hope to do, or what you think the audience might be interested in knowing about multi-cloud.
I'll start. I have the mic.
Perfect.
Change management is key. It's interesting. Healthcare IT, we change and we inflict change on our users every day, but don't ask an engineer to change what they do. They're resistant. It's somewhat funny, but help them see that, right? Their job is to change the environment, which means they have to change themselves. Educate and support are probably the two other big items that we're doing at Baptist. Enabling the team for training, education, letting them help define some of the future job role and include them in the process from the get-go. I think that helps smooth the way, and it's not revolutionary, it's just normal change management, people management aspects. So some of it's going back to basic non-technical things to help make that transition a reality in the environment.
Love it. Great advice. Juan Luis?
Well, I think in my view, I think something is changing in the public sector, in Europe at least. We are now really moving to the cloud, but we have to work a lot on a strategy. You mentioned value proposition, use cases, you mentioned research, you mentioned accessibility of data. We have to demonstrate to the decision makers, to the politicians that govern the public health sector, that is something that has a lot of advantages to us, and not to us, but to clinicians and to patients. That is a key point.
Excellent. Sunny, final thoughts?
I'd say it's just really important to be empathetic. So, Jim, you talked a lot about the teams that you are responsible for, the engineers and the IT teams. And I also think that it's important that on the lines of business and even at the executive level, that we all consider where the other person is coming from, the other team is coming from, and try to get closer to each other, create that translation, understand the other person's perspective, the other team's perspective. Because I think that because technology is advancing so rapidly, and that's going to continue, that our clinicians, our lines of business users, our execs understand more about what they expect from technology than what they've ever had before. And so making sure that both sides are talking to each other in a respectful and understanding way, taking a little bit more time to make sure that we're understanding the requirements and the needs before we just start going out and either buying something new or acting and doing something new is going to be critically important, especially as we start to see the advent of Gen AI. It's not about adopting the newest, latest bells and whistles, but what really do we need in order to achieve our business objectives?
I love it. George?
Yeah, I'll finalize it with value proposition. The four things. Value proposition is really important. How are you going to provide better services to your organizations clinically and from a business perspective? Once you get that, what's the operating model that's going to enable it? What's the people process side of the whole business that you're going to retool IT to be able to provide and exploit these services? Then finally, the economics. Make sure you're taking a look at the economics in a really important way. And that all comes back down to the applications and looking at the applications and understanding how they're going to work, where the benefits are, how you're going to govern the data, all that good stuff. And then finally, the fourth one is security, right? You got to wrap all that up with what we talked about with security. So value prop. What are you looking at from an operating model perspective? Make sure you involve your apps in that value prop, and then finally wrap it with security.
Awesome. Well, I appreciate all of our panelists for sharing these insights and perspectives. Thanks everyone for watching. And let's give a round of applause to our panelists and Dell Technologies for hosting this event. And be sure to go check out the hashtag TransformHIT. Dell Technologies shares tons of great content that's really relevant, so be sure to check it out. Thanks, everyone. Come say hi to the panelists.